healthcare.
Pediatric specialists are specialists in children and youth, and we do not have the training or the years of experience taking care of adults or grown-ups that a family physician or an adult provider has. And so there comes a time when we're just not the best doctor to provide for the individual's needs. So that's why we need to make the transition.
When you go to the doctor, having questions on a list, a piece of paper that you might have maybe about your diagnosis if it's early on, or possibly your medication, or whatever questions you have about your treatment plan. And once you get to the doctor, if the doctor says something that you don't understand, to ask questions there about medications, whatever it may be. So advocating for yourself.
Shantina is aware of her needs, her medical needs. She knows who her physicians are. She knows where her supplies come from, her other assistant devices. She knows where it's come from. But as for actually coordinating her appointments and making sure things are followed through is either myself or my mother.
We did start when she was 12, having her take her own medication, and much of the time she orders her own medication. She does make her own doctor's appointments.
Insurance, which is a major thing with healthcare. What type of insurance do you have? Do you have private insurance? And if you do, under what? Is it under your parents, or is it under your employer?
Looking to what's available if the youth is going to be in an educational setting. There may be a health insurance they can buy through the educational setting. There may be, if they're in a community college, the community colleges don't offer their own plans, but if the young person is studying, they'll be eligible for a plan. There are some plans that are reasonable in their expense.
If you don't have insurance, I'd find out your university normally has a health clinic where you can pay by visit, or they'll charge it to your student account, or you can go to urgent care if you get a cold or the flu or something and you need medicine.
And there are also some resources at the state and at the county level through their local health department. There's some folks that can sit down and say, here are the options and how can we make this work, and let's see if we can find something. That's not to say that you can always find a solution, but with being well informed opens the options. You can know what the options are and see what you can arrange. The big message here is to think ahead, have a plan, and have a relationship, relationship with a practice, whether it's your pediatric practice or a family practice or an internal medicine practice. Start early in the individual, knowing what their health care issues are, what their needs are, what their medicines are about if they have medicines. If they are not on medicines and don't have a health condition, to know themselves what are their immunizations, what are their immunization needs, what do they need to do. Have them begin to assume the responsibility for their health earlier rather than later.